Good morning, madam. So today about my poster, I'm going to be explaining about 3 issues about COVID-19, which is precaution and prevention methods, individuals at high risk, and symptoms and testing. So first, what is coronavirus? This virus is known as the severe acute respiratory syndrome coronavirus 2, which is also as SARS-CoV-2. This disease it causes is called coronavirus disease, COVID-19. In March 2020, the World Health Organization WHO declared the COVID-19 outbreak. Coronaviruses are a family of viruses that can cause illnesses such as the common cold, severe acute respiratory syndrome SARS, and the Middle East respiratory syndrome MERS. The first issue that I'm going to talk about is the precaution and prevention methods. First is we should avoid handshakes. Second, clean your hands frequently. We should clean our hands with an alcohol-based hand rub or wash your hands thoroughly with soap and water. Third is keep your hands away from your face. This causes pathogen to pass from the hands to the mucous membranes of the eyes, nose and mouth. Fourth is hygienic coughing and sneezing. When coughing or sneezing, we should always cover our mouth with our hand. This is to avoid bacterial spread towards others. Fifth is we should keep our distance and avoid crowds. The minimum distance we have to avoid people is at least 1 meter. Next, we have to pay attention to our first symptoms. If we have fever, cough or difficulty in breathing, we have to see a doctor as soon as possible. But we have to call beforehand so that we are directed straight to the right health facility and avoid getting in touch with too many people. Lastly is we should use a face mask. The World Health Organization WHO recommends to wear a face mask only when you are taking care of a person suspected with COVID-19 infection or when we are out in public. Okay, so now I'm going to talk about my second issue, which is the symptoms and testing. For most common symptoms, we have 3: fever, dry cough and tiredness. However, the most serious symptoms, which are difficulty in breathing or shortness of breath, chest pain or pressure, and the loss of speech or movement. If we ever result to any of this, we have to seek immediate medical attention. Always call before visiting the doctor or health facility. Next, we have the testing of COVID-19. The Ministry of Health's COVID-19 guideline presently only recognizes PCR tests. Our Health Director General Dr. Nur Hisham Abdullah said MOH uses 2 types of antigen tests to detect this virus. These 2 tests are called the gold standard RT-PCR test or the antigen RTK. These both tests require nose and throat swabs taken by trained professionals wearing suitable personal protective equipment PPE, as well as laboratory equipment like biological safety cabinet while processing the test samples. The first step is RT-PCR, real-time reverse transcription polymerase chain reaction. This is the aim to detect the COVID-19 in the patient's body. The second recognized test is the RTK, Rapid Test Kit. This only works for RTK antigen. The RT-PCR helps in confirmation of COVID-19. However, the RTK antigen positive indicates that the individual is infected. Individuals at a high risk contracting for COVID-19 if we come into contact with someone who's carrying it, especially if been exposed to their saliva or been near to them when they coughed or sneezed. Other people or people with certain health conditions who have a higher risk includes that their health condition, lung conditions such as COPD and asthma, certain heart conditions, immune system conditions such as HIV, cancer that requires treatment, severe obesity. Other health conditions, if not well managed, such as diabetes, kidney disease or liver disease. So all of us have to be very careful and meticulous when we come across COVID-19. So we should always take care of our health, safety, so that the frontliners who sacrifice their life doesn't go in vain. So that's all I have for today. Thank you.